I'm Jackie Lookstead. I'm one of the first year surgery residents at Valleywise Health, part of the Creighton, Arizona Health Education Alliance. I'm from Shoreline, Washington, so just north of Seattle. You know, grew up really close to the mountains and the ocean, so very outdoorsy. And then I traveled a whopping 15 miles south to the University of Washington for undergrad. I studied biochem and with a chemistry minor just to solidify that I'm a nerd. And then I moved out here for medical school and I went to Midwestern up in Glendale. And now I'm here.
Awesome. Well, that kind of answers my first question about where you're from and where you went to school. So what made you decide to pursue a career in medicine, and what was that journey like becoming a doctor?
Yeah. Oh gosh. So there's never been a doctor in my family. So when I was growing up, I didn't really ever think it was a possibility. It wasn't even something I considered. I just always loved school. I loved studying. I love science. I love people. You know, when I was entering college, I knew that I wanted to help people, but I didn't really know how I was going to do that. So once I got to college, you know, I remember seeing all the pre-meds and being like, oh, look at those nerds, you know, never thinking that I would be one of them. And then, you know, the more I got to know them, the more I realized our interests were the same. You know, intuitively, like medicine provides the opportunity to help people. You know, you still get your science, you get to work with people every day, and you get the opportunity to make a really big impact. So that was exciting. You know, it took a while before I felt comfortable that I could actually pursue it, you know. But once I got into biochem at UW, I was like, you know what, I think I'm smart enough to do this. Let's try it out. And then the first time I shadowed surgery, it was at Seattle Children's. You know, I didn't really know what I was doing, but I remember distinctly from that day that 5 hours felt like 5 minutes. You know, as soon as I stepped into the OR, I felt like I was home. So, you know, at that point, I was like, oh, I'm going to have to figure out how one becomes a doctor, because I don't think I'd be fulfilled without it. Wow. So that kind of started me on the path to becoming a doctor.
That's amazing. So how did you land on Midwestern then? Like, how was your process like applying for schools and stuff like that?
Yeah. You know, I think it just kind of was the one that I got into. I've always been interested in coming out to Arizona anyway. You know, I'm a sun lover, and like we talked about in Seattle, there's not a lot of that. You know, I'm a really big hiker too, so I loved being out here for both of those things, because I'm one of the Looney Tunes, you know, that's hiking when it's 105 degrees. I'm out on Camelback. So, you know, I was excited to check it out, and once I went there, I was like, yeah, I think I can do this. So that's kind of how I got here.
Awesome. So you mentioned that, you know, one of your biggest passions was when you went into the OR and you realized surgery was your calling. So surgery, you would say, is your main passion, but what are some of your other passions that in medicine that like that kind of push you to continue on with your education?
Yeah. You know, at this point, I think most of them surround surgery. I'm not a huge person in research, although I'd like to get more into it. But I think it all mainly centers around surgery. You know, just having the ability to work on my technical skills. You know, surgery just, it's amazing for me. When I was growing up, I was a really big soccer person. Like I started playing year round when I was like 10. My email address was soccerjackie@hotmail.com. So something I loved about surgery is like that it's another ability or another way to perfect a technical skill. You know, I used to, if my touch was off, I'd go do volleys at home by myself until I felt better. Or if someone beat me in a sprint, I'd go run by myself at the track. You know, always pushing myself until, I was proud of my skills. So I think that's something that surgery has to offer. And, additionally, you just have so much ability to impact people, not only from a medical standpoint, but you literally have the amazing opportunity to perform surgery. If someone's gallbladder is sick, you get to be the one that takes it out and makes them better. So I just love it. So currently that's my main passion in medicine, but that could certainly, evolve over time.
That's amazing. That's awesome. What was match day like for you? Can you kind of share about what that was like?
Yeah. So very strange. In years past, everyone gathers at the med school and you all like open your letters together, and it's a big tradition. But last year it was during COVID. And so it was kind of the beginning of it, but we didn't have that ceremony. So what some of my friends and I did is we went to one of my friends' house. There's probably like 6 of us. And we, because you get an email when you get accepted. And so one of my friends that wasn't matching that year took all of our phones and wrote down on pieces of paper where we were going. And then, so to kind of like simulate the ceremony, they gave us all envelopes. And I remember 2 of my best friends, they're couples matching. So they went first and they matched in Florida, and they came back in all excited. And I was like, oh my gosh, it's time to open my letter. And when I opened it, I was so happy. I was so happy to be here. I probably looked like a Looney Tune again, just hysterical, but I was so happy to be here.
That's amazing. I love how you tried to make it as normal as possible, right? In the circumstances. Yeah, that's amazing.
I think that's a big theme of this year, is trying to, have some sense of normalcy when everything's just kind of out of whack.
Mm-hmm. So, you mentioned you were so excited to be here. Like, what do you enjoy about doing your residency at Valleywise? How is it different than other places you've trained at? Why were you so excited to get Valleywise?
Yeah, so when I was a 3rd year medical student, like my 2nd rotation was at Valleywise in surgery. And so I kind of knew what I was getting into when I chose to come here for surgery. And something I love is the opportunity to serve the underserved. That's something that really got me into medicine in the first place, the ability to help people. And that's huge at Valleywise. As a safety net hospital, we have the opportunity to help those who really need it. And I think something that's interesting in terms of healthcare disparities, driven by social and economic inequities, very complicated, complex problem. But one of the best ways to combat it is through diversification through the residents and through the faculty. Something I really like about Valleywise is there's a lot of women in surgery. Our program is like over half, over 50% female, which is amazing for a surgical program. And additionally, we have a lot of faculty that are females. So that's something I really loved. And then further, when I was looking for a surgical residency, I wanted somewhere where you get a lot of operative exposure, so that, I'd graduate and be a really good surgeon. A lot of early operative exposure, which is something this program provides. I've already gotten a lot of cases compared to my other friends at other programs, and that's amazing. I wanted somewhere that would set me up for success, and Valleywise traditionally matches very, very well. Last year, some of our graduates went to Harvard, some went to Mayo, in all different specialties too. So I knew that if I came here, whatever I wanted to do, I'd be supported. And then ultimately for me, I just wanted to know that, everyone around me had my back, or that I would really fit in. So it was really helpful to do a rotation here. And I just kind of felt like I found my people. So for all of those reasons, I came here for surgery.
That's amazing. That's awesome. Well, we're happy to have you. Your energy is infectious, by the way. I love it. So
Thanks.
um,
Love to.
so you mentioned about like interacting with the faculty, that half the faculty is female, which is amazing. Can you kind of share more about what it's been like working with this level of faculty, and kind of share about like maybe one faculty member who's challenged you or pushed you and made you a better surgeon?
Yeah. So all of the faculty are lovely. They're very welcoming. They're very intelligent, great teachers, and great role models. And I feel really lucky to have them. I think one moment that sticks out is I think it was like my third or fourth rotation this year. So still pretty early on in my intern year. And one of my attendings said, Jackie, it's time to take ownership of your patients. And at that time, I didn't really understand what that meant. And I was like, of course they're my patients. Of course I'm taking ownership. But what she was alluding to is that as a medical student, making the transition from medical student to resident, there's a shift in perspective that comes with a shift in responsibility. As a medical student, you're kind of the fly on the wall. You see some patients, write some notes. You try your best to be helpful, but ultimately you're kind of limited. And then you become an intern, and all of a sudden, you have this power. You're putting in orders, and you're admitting patients, discharging patients, and you feel like, you have a more active role on the team. But then it doesn't just stop there. There's kind of a greater evolution when you really start becoming someone's doctor. And it's scary at first because you rely on the whole team. But what my attending was alluding to is that, picture you're in a vacuum, which certainly isn't the case, but say you are the only doctor for this patient. And how would you react? And what would you do? You're ordering the tests, but are they done? When are they done? What were the results of those tests? Have you talked to the consulting services? Always keeping your patient on the path towards healing. Because if I was a patient, that's what I'd want my doctor to do. It kind of took a while to click for me. But what she was saying is, you are this person's doctor, so it's time to put on your big girl shoes, eat your Wheaties, and get to it. So yeah, I think that was a very formative moment of the year.
That's amazing. And you kind of hit on this earlier, but you said, this was your first year in residency in a global pandemic. In what ways was it helpful? In what ways was it hinder, like kind of share with us what it was like, jumping in your first year with, it's such a, crazy time.
Yeah. It's somewhat hard to say what it would be like if it wasn't in a pandemic. Since this is my first year, it's all I really know. There's a few things that it kind of taught me. One thing, I guess I'll start on a lighter note, is that a lot of people surprisingly have goatees. You never see people without masks. You see them for the first time, you're like, what the heck? But further, I would say, it really taught me the strength of the human spirit, that all of the people around me, saw so much tragedy this year, especially the nurses working in the COVID ICU, and just to see them, persevere day in and day out and just do what they needed to do for the patients is really beautiful. And I think the most important lesson from this year is how important connection is to the human experience. I think something that was so hard was to see my patients' families, how frustrated they were not to be there for their family members when they were sick. And personally, my grandma had a massive stroke in January. And it was really hard for my family, that we couldn't all be there with her during her final moments, and seeing my patients and my patients' families go through the same thing was really hard. But I think it further solidified how important it is to maintain those connections. We were crazy busy, but you still have to make time to call your mom and to FaceTime your family and to spend some time with your friends or your significant other or your dog or whatever makes you happy. Because at the end of the day, that's really important. Yeah. So that's kind of what I learned from COVID.
That's beautiful. And yeah, and I'm sorry that you had to go through that. I know everyone experienced some sort of loss or heartache this year, but I think all of us, even from the foundation perspective, we're not in there day in and day out with you guys, but just hearing the stories of what you guys have had to endure this year. So thank you for everything.
Of course.
Well, and so what are some of the things that if you could wave your magic wand and make them appear in your time, during your residency program, what are some of the things that you wish you could get out of it, and the ways that you wish that Valleywise could support you over the next remaining 4 years? What are some of the new, the program, whether it's scholarships, mental health support, what are some of those things that would be really helpful?
I think all of those things would be helpful. Something I've been thinking about is how much we have to learn in so little time. And, especially in the time where wellness is really emphasized. Part of that is the 80-hour work week, which is great, but it sounds like a lot, but it's really easy to fill. 80 hours is not very much. And to learn all of patient care, just basic patient care, and then in the perioperative setting, the postoperative setting, and then on top of that, in an age where we're moving more towards minimally invasive surgery, on top of patient care and basic medicine, we're learning open surgery, we're learning laparoscopic surgery, and then on top of that, we're learning robotic surgery. So there's so much to learn in just a really short amount of time. So I think really anything that improves efficiency is incredibly helpful. Something that I really like about Joe's is at St. Joe's they were recently recognized as one of the robotic centers of excellence, which is a huge accomplishment. And something that's been really helpful in my training is they have a practice robot that you can go on, or during January when there weren't a lot of elective cases, one of my attendings set up one of the ORs and kind of like a mock robotic simulation with a real robot. And it's just so helpful to have those moments and those experiences when you just are so limited out on time. Really having, intentional educational experiences to maximize your time is great. And so anything with simulation, anything with improved technology, so that once we do enter the real workforce, we hit the ground running. And further, anything that helps with wellness, because try as we might, it's really hard to keep any sort of balance when you're in a surgery residency. When you get an extra hour to sleep or eat or anything, you're amped. It's the best day ever. And it's really important to keep yourself well, because that's how you best serve your patients. So, another thing I was thinking is on one of my rotations in medical school, I was at a hospital that had this whole wellness area for residents that I thought was amazing. It was this very sunny, large room. There were a bunch of offshoots. There was a yoga studio. There was a little area with a bunch of gym equipment. There were some rooms to sleep. There was a couch. There was a kitchen, kind of everything you needed for quick wellness was there. And I thought that was a great idea because, when you have 2 minutes of extra time, you can you can take a little time for yourself and recharge so that you can be the best you can for your patients.
That's
So
that's awesome. But they,
yeah.
yeah, wow. And you kind of hit on this. So, you mentioned with the future and like what you're learning through like all these different simulations. One of my questions that I wrote down and I wanted to, it was kind of far back and I want to kind of come back
Yeah.
to is what are some of the obstacles that you see the industry like in surgery you guys having to overcome, and then where has there been progress made? Like what do you see in the future of what you've been learning and where the future holds?
Yeah, I think in terms of the actual industry, I don't know a ton about it. What I do know kind of is emphasized by having more women in surgery and having more, um, faculty that are women, because that'll just improve the future of surgery. I think that's something that we do really well. And I think, like I was touching on, that everything is moving towards minimally invasive. So I think having really good training in that is really important and something um, that we do fairly well here, but we can always do better.
That's so interesting. Just a small anecdote I was sharing with one of my aunts had to have some sort of like she had a labrum torn, I think, and it was like 20, 30 years ago. And her scar like goes all the way down her arm. It's huge. And now it's like two little incisions. It's like so different.
Yeah.
It's so interesting how like the evolution has been.
Yeah, and it's interesting too because you still learn those the open techniques. So there's so many different ways to do things, which is really exciting. But it's just so much to learn in so little time.
Mm-hmm. Like how do you absorb it and take it all in?
Yeah.
Well, so what are some of your, what are some of the biggest things you want to get out of your residency, and then what are some of like your dreams and your aspirations for when you're done, and like what it looks like when you leave?
Yeah, so I love trauma. So currently, what I want to go into is trauma critical care. One, because I feel like that's one of the most vulnerable populations that really needs your help. And I love being that person in the trauma bay that's acutely managing someone who's really sick. I love being able to take them to the operating room and fix them, and then watch them on the floor get better and then discharge and follow up in clinic and see how they progress. I really like trauma. And I'm someone that more so likes the open surgery. So I love how that affords me that kind of way to make a difference. And additionally, I just had my burn surgery rotation at the Burn Center, which is an amazing place. And I kind of loved it. So, I think at this point, maybe trauma critical care and some burn. I'm still early on, so currently the world is my oyster. So there's a lot that I can still do and learn, but ultimately I would love to be a trauma surgeon, and I would really love to stay here in the Valley, just because I'm so happy here. So that's kind of my goals currently and my dreams.
That's awesome. I was gonna ask, I'm like, are you gonna stay? Or are you? But
I'd love to stay.
That'd be awesome. Well, I've got one more question, and it's kind of our thank you message. But before I do that, Lisa, Alon, is there anything I missed or anything you'd want to ask Jackie?
Jackie, I liked that you talked about the sim and the wellness, because people need to hear that. They think GME funds come down and we've just got, this huge bank of money and, we can spend on everything and, we don't.
Yeah.
And we still have, needs. I think one thing I don't know if you've been involved at all on what the new hospital is going to look like. Do they talk about it? If you could just, even if you don't know, just maybe some comments, talk about In a couple years, Valley Wise Health will have a brand new, medical center, which will give you unbelievable operating rooms. And
Yeah.
even if you don't know a lot about it, it's sort of a soundbite that I think then inspires people to give toward that.
Yeah. Um, I don't know a ton of what the layout's going to look like, but something that I hope is there is really, high tech, large ORs that help us train and help us do the best for our patients. In terms of wellness, I would love to see a wellness room like I was talking about. In terms of resident wellness, something that I like right now is we have a little resident room where we can get snacks and coffee, while we're on call and stuff. I think that could be expanded to have more healthy options too. Not just some chips and cheese crackers, but like maybe some vegetables or something like that. I think having a sim center at Valleywise that's similar to the sim center at Joe's would be really helpful because, like I've touched on, we don't have a ton of time. So to go between campuses for all our simulation needs is, kind of difficult sometimes. So to have robotic and laparoscopic practice at both campuses would be amazing. I think is something I kind of hit on too is having a gym or some sort of exercise apparatus at both campuses would be nice. Joe's has a fairly nice little gym in the basement. I think Valleywise could do the same. Otherwise, some things that I think would be nice is like a nice healing garden or something like that for the patients if they're able to go out there during any breaks that they have because that'll better improve their healing. Otherwise, really anything that's up to date and new and it's just better for our training and will improve our future and improve our care for our patients.
Thanks. And our surgeons in Arizona were pretty low. You probably look at those stats too. I think we ranked maybe 40th out of the states. So I don't know about the physician shortage and just any general comment you have about that. I mean, I know I'm catching you on the fly, but I think people don't realize we are the fastest growing area plus the fastest growing county, but yet here we're 40th with our surgeons. That's not working right for us.
Yeah, I think something that is difficult about a surgeon shortage is that it's kind of a big choice to go into surgery. You sacrifice a lot in your life. Not that you can't still have a life. I'm a huge proponent on you can do whatever you want. You can have a family, you can have kids. It's just a little bit harder when you're a surgeon. I think that's something that's difficult for women going into surgery too. Is you have to really know that you wouldn't be happy doing anything else before you go into surgery because it's going to be really hard. So as that pertains to a shortage, it's a big step to go into surgery. And then further, we have a lot of rural communities in Arizona, and it's difficult to be a surgeon in a rural community because you're fairly isolated. And you don't have the same technology that you're used to in the city, like for even just a gallbladder. It's not like we just use a right upper quadrant ultrasound. You have HIDA scans, you have MRCPs, ERCPs if you're concerned about any duct pathology. There's a lot of technology that isn't available in those rural places, and yet there's still patients in those rural places that need you. So it's just difficult to staff everywhere that there's a need. And I think really getting people who want to do rural medicine and surgery and training them to do that and afford them those skills so that when they're in those rural areas, they're able to serve their patients and feel comfortable. That's really important. I'm Jackie Lookstead. I'm one of the first year surgery residents at Valleywise Health. And I'm just finishing my first year actually. And your support for Valleywise means a lot to me. And I wanted to thank you. I've gotten here with so much help from my family and friends. No amount of resiliency is sufficient without them. They never saw me as just like an average little girl from Seattle. They always saw me for my potential. And no one ever doubted that I'd become a surgeon, even if I doubted it. So to anyone that wants to be in that supporting role, to help the next little girl from Seattle achieve her dreams, or help any of the amazing physicians in training that I'm surrounded by every day, it means a lot. And your kindness and altruism, it's noted, and it's really important. And thank you.